哈利德·马苏德·贡德尔教授。他是巴基斯坦内外科医师学院 E-log 系统的创始人之一。2013年被授予3级军事卓越奖章，2020年被授予总统荣誉奖。他报告的题目是高等医学教育数字化概念方法与组成。
Thank you, Professor Wendy Long and Mr. Liu Ying, General Secretary of the Brahmia, Vice President of China Medical University. And I feel honored that my institutions have been the founder member of the Brahmia. I am the Professor Emeritus of King Edward Medical University and have been the Vice Chancellor of this institution. And currently I am also the Senior Vice President of College of Physicians and Surgeons in Pakistan, the main postgraduate body of the country. Now I have the honor to discuss with you the role of the information technology and digitalization in higher medical education and its institution, and something about the innovation. Now before I go into the detail of all these things, both in King Edward Medical University and in College of Physicians and Surgeons in Pakistan, we maximally utilize the information technology and we made our environment as the digitalized. We have got the paperless environment, we have introduced many innovations, we have implemented the campus management system, that is everything is online, which include like the fees submission of the students, the training, the accommodation, their information. We have got very active website and interactive too. Similarly, we have introduced paperless environment and information technology in the administration, financial management, payroll, inventory, procurement, and as far as human resource is concerned. Our examination, they are by the grace of Allah Almighty online examination. We have introduced this system in undergraduate as well in the postgraduate examination. Similarly, the results they are online, and submission of the MCQ, strengthening of the MCQ bank is through the portal. Our examiner, they submit the question paper and similarly they are being evaluated in that way. We have implemented the learning management system in the university, in the college. Our teachers, they use this technology in the online lecture and in the online assessment. Now at the level of the university, we have got various undergraduate courses like MBBS, Allied Health Sciences, Physiotherapy, Nurses, and similarly we have got the postgraduate courses, and campus management system is implemented both in the undergraduate and the postgraduate. Our King Edward Medical University has got mainly King Edward Medical College, and we have got basically undergraduate MBBS program. Here the learning management system is fully implemented. This is one innovative example. When we had the COVID crisis, the traveling restriction they were there. Our students, they stuck off in UK, UAE, Afghanistan, and then we managed the online examination through this information technology in a very successful way. And this very important thing I want to introduce to all the audience, that is the use of the teleservices, telemedicine services during COVID-19 pandemic. You know, we had the corona in 2020 and 2021. So we established under the direction of our Chancellor initially the Corona Help Desk in all the universities, and then our outpatient department of the hospital, they were closed, and the patient, they did not have access to the doctor. So then we decided at the level of our King Edward Medical University to have the teleconsultation and tele-outdoor, and we established 16 counter. They include medicine, surgery, psychiatry, pediatrics, gynae, pulmonology, orthopedic, cardiology, dermatology, ENT. Then later on we expanded like tele-obesity, tele-ophthalmology, vaccination, nutrition, and currently we have the infectious disease. So we introduced the tele-dengue, HIV counter, and lately the tele-dentistry counter. So this tele-consultation services, they are successfully going on at the level of King Edward Medical University, and the mode of communication which we have used in this teleconsultation, they are mainly the mobile, the Android, WhatsApp and Skype technology, online web portal that is there, and if the people they are having the net problem, the landline facility that is also there. If you visit the website of King Edward Medical University, you will see all the numbers they are there, and along with that number on Google Play Store we have got the app of telemedicine King Edward Medical University. You can download that app, and through that app if you call our doctors from 8 AM to 2 PM, they are available on these 16 counters. And I will request all the audience who are listening to my speech, they should have this experience. Please download the telemedicine King Edward Medical University app, then have the experience of consultation of my specialist in 16 different counters. There is a portal for the administration, portal for the doctors, portal for the patient. So in case of the patient portal, patient have got the facility of the appointment, and there is a slot of the 15-minute, and the most important thing is when you get that slip of the appointment, you will see the WhatsApp and the land number. And another important thing is this consultation is free of cost and available for all the people of Pakistan, and this is available for all the people of the world even. And we have received call from 80 different districts of Pakistan and 45 countries of the world. This is the doctor portal. I don't want to go into the details of the doctor portal, where he can search the patient record, his first visit, his second visit, his follow-up visit, and outcome of the teleconsultation that is there. The one example, after the appointment, the doctor have the teleconsultation, then he prescribe the medicine. This is how the prescription slip will be delivered on the mobile telephone of the patient, and he can then contact the pharmacy and get that medications, the details of that prescription. Similarly, the administrative portal has got the detail of all these patients, their record, their ID number, and for the purpose of the confidentiality, the admin portal ID and password is only with the administrator. This is the detail of the administrative dashboard. To date, we have given the teleconsultation to 17,866 patients, and you can see the detail of all these patients that is there, and call which we are receiving from all the provinces of Pakistan. Maximum number of calls they are from the province of Punjab. We are receiving call from every city of Pakistan. Naturally, we are based in the main city of Pakistan, that is the Lahore. So maximum number of the calls they are from the Lahore city. They are 9,200 plus. And this service is not only for the people of Pakistan. We are offering this service to our expatriate, whether they are in the Middle East or in the Gulf states, or even they are in the developed world. This is the slide you can see. Our expatriate from UAE, from Saudi Arabia, from Middle East, and even from the developed world, and our brother country like China, they have also called our doctors who are sitting on this telemedicine counters. Lastly, we had the maximum number of calls from Saudi Arabia when I happened to present this project in Dubai Expo in 2020. So since then we are receiving the maximum number of calls from UAE. And this is the teleconsultation we are using for the research purpose also. The age-wise statistic, the youngster they are calling mostly, they are also calling for their parents too. Similarly, the female and male ratio is in front of you. Mostly the male they are 18,000 plus, and the females they are relatively less. And then another important thing, at the end of every call, we take the feedback, and the satisfaction rate is over 98%. But 2% of the patient and the relative, they feel they still need more information. This is the online address of the admin portal. Obviously the ID and password is with the administrator, but the second address is for the appointment. I will request all the audience to note this second address, and please get the appointment of my doctors sitting at the telecounters of King Edward Medical University, and please do let us know the feedback. This is the Dubai Expo of 2020, when I had the honor to present my telemedicine project innovation during COVID-19, and I think the majority of the people sitting over there, they appreciated telemedicine and teleconsultation project of King Edward Medical University. Now, after discussing my presentation on Dubai Expo of this telemedicine, I want to highlight another important aspect about the postgraduate medical education. The topic is the utility of this IT, information technology and digitalization. And before I discuss, I just wanted to mention the world has got the challenges as far as the postgraduate medical education is concerned, challenge related to the induction, accreditation, monitoring, training, evaluation. And we have felt one thing in under and postgraduate medical education, there is variation in the training, and we have addressed the variation of training through effective monitoring. Lastly, we had the manual logbook, but now at the level of College of Physicians and Surgeons in Pakistan and King Edward Medical University, we have shifted to e-log system. The 30,000 trainee of CPSP, they had got ID and password. 4,500 supervisor, they have got ID and password, and this e-portal is for supervisor, for trainee and for fellows. And through this is the dashboard of that e-portal, in which all the information they are there on the e-portal, and we expect that the trainee, they will enter their competency on weekly basis, and the accredited supervisor, they will approve those competency and they will submit to the college after every 3 months. And you can see this portal has got all the information of supervisor, trainee, the courses, the evaluation in everything. This you can see is the template of that e-portal of the supervisor, where on one side this is mentioned whether you are giving a regular feedback to your trainee or not. Similarly, your creditor, then the names of your trainee and the competencies which the candidate has submitted, whether you have approved or not. This is another important slide which indicates the competency which trainees submit and that is waiting for approval, that appears as the blue. If you have approved, that appears as the green, and the competency which you have not approved, that appears as the red. So before the postgraduate residents sit in the examination, 80% plus competencies, they should be in the green. That indicates the resident has achieved those competencies. This is another important slide where the feedback of the trainee and supervisor is important. In this feedback, we see the punctuality, the performance in its evaluation, professionalism and ethical practices, that is very important, behavior with the patient, behavior with the colleagues and behavior with the seniors and junior, all these things that is there. Similarly, in the e-log of the trainee, all the material of the workshop that is there, all information that is there, the prospective that is there, and the trainee competency which have been approved, that is in the information of that trainee. This is the live demonstration of e-portal or e-log system of College of Physicians and Surgeons in Pakistan. I think because of the constraint of time, I am not going to discuss that in detail, but I will request the audience to please visit the website of College of Physicians and Surgeons in Pakistan. You will like to know and you will see the detail of this e-portal, and you will be happy to know that this e-portal is being used by 30,000 postgraduate resident of CPSP and 4,500 supervisor of CPSP. Then coming back again to the digitalization and use of information technology during COVID and onward, we are using this technology for webinar, for seminar, for international webinar and international seminar. I am grateful to the people of the China. I think they were invited to Pakistan when we started the COVID. We had initial physical meeting, then these online webinar and seminar, they were going on, and our alumni, they also participated, Kemkana and Apna. And then I am again grateful to all the audience and the management committee of the Brahmia. This is 2020 Brahmia meeting, and King Edward Medical University have the honor to be the keynote speaker. Similarly, we have the honor to participate in 2021 Brahmia meeting, in which we also presented the updates of King Edward Medical University. And again, I take this opportunity to convey my heartfelt gratitude on behalf of King Edward Medical University and College of Physicians and Surgeons Pakistan for giving us the opportunity for the third time for presenting ourselves the updates of College of Physicians and Surgeons Pakistan and King Edward Medical University. So I am grateful to all the organizer of the Brimia 2022. Thank you and thank you everybody. King Edward Medical University and College of Physicians and Surgeons Pakistan, Zindabad and Pakistan, Paindabad.